So this is the last case. 20-year-old female amateur MMA fighter, foot drop after 5 days of intense kick training session. Her coach kicked her posterior upper thigh a lot. And let me show you the images of this case. So here are the images of this case. Let's start with this T2 with fat saturation, and we can see right here. Look that this is the right sciatic nerve. This is the left sciatic nerve. Look the size and the signal of the sciatic nerve. It's totally different. The left sciatic nerve, it's bigger, it's larger, and it has a bright signal, a high signal in comparison with the other size, with the right size. So this is neuropathy of the sciatic nerve due to this training session with the direct trauma, chronic direct trauma at the sciatic nerve, close to the ischial tuberosity right here. So this is the T2 axial image. I'm gonna show you here now the coronal image, and it's a kind of stir image right here, and we can see the right sciatic nerve right here and the left sciatic nerve, high signal intensity in this left sciatic nerve in comparison with the right sciatic nerve. And this is that T2 space image that is that we use a lot to evaluate and to reconstruct some images doing neurography, and we can see the difference between the left sciatic nerve and the right sciatic nerve. And in this case, just to show what happened with this case. So this was the finding. This was the finding that I just showed you. And this was our neurography showing the difference between the two nerves, the high signal intensity of the left sciatic nerve. This is post-contrast imaging showing the enhancement of the left sciatic nerve. The patient also has signals, signs of ischiofemoral impingement, at least for by image. I'm not clinically, I think. And I just want to show the nervation area that was happening at the posterior thigh of the patient and also at the leg, the left leg of the patient when you compare with the right leg of the patient. And 1 year later, the patient come to us to do a follow-up. And in this follow-up, she was asymptomatic. And by image, the nerve, the left sciatic nerve, it's okay. There's no lesion. We can't see any lesion at the left sciatic nerve. So it was a happy ending of this in this case. And with this happy ending, I finish my participation as a panelist showing cases for this course.